Good afternoon. I'm Adam English. I'm a board-certified nurse practitioner with the Minnesota Center for Orthopedics at Cuyuna Regional Medical Center. Today I'm going to talk to you about knee and hip arthritis, one of the most common conditions that people experience as we get older. Arthritis is actually the number one chronic disease in patients over 65 years old, so this is actually very common. How I'd like to explain arthritis is it's similar to a set of tires on a car. Our skeleton is given so much tread, and as we age and use our skeleton, the tread begins to wear out. Factors that can make this worse or speed it up would be if somebody fractures their bone or throws the alignment off of the skeleton from previous surgery, stuff like that, that can lead to earlier arthritis. The definition of arthritis is simply inflammation of a joint. It can be from various causes, but for today's discussion, arthritis will be generally inflammation of a joint. So just a couple of interesting statistics. We're looking at huge volume increases in the next 9 to 10 years. We're looking at total hip replacement increasing by 175%, knee replacement by 675%. What's happening is the baby boomer generation, the generation of people born after World War II, is a very large number of people, actually the second largest generation now to the millennial group. And what this generation did is they've worked very hard at a very young age, and as we get older, as mentioned, the tires have so much tread, and they begin to wear the tread down. So there's a huge demand for the need in joint replacement here in the next 9 to 10 years. However, being a surgical specialty, we also look at non-operative interventions, and today I'll talk about the signs and symptoms of knee arthritis, signs and symptoms of hip arthritis, and the common treatments for both. We'll start with the knee. So the knee is one of the main joints of the body that takes on wear and tear. It's a hinge. It's like a 90-degree hinge. It bends and extends. Every step we take, we use it. As far as knee arthritis goes, some of the symptoms you might experience are pain with going up and down stairs, pain with standing. Certain motions might make the pain worse. Typically, knee pain hurts into the knee, but we can see it extend up to the hip. Some of the things you'd want to do for this would always start with non-surgical interventions first. So the first thing we're going to want to do is try activity modification, exercises, physical therapy. We could try some medications in the form of anti-inflammatories. However, we need to use these very sparingly, as they can really be harmful to both our stomach and if you have an underlying heart disease. Typically, when a patient comes to see us in orthopedics, they've tried some of these things, and then when we see them in the clinic, of course, we're going to get a set of x-rays to look at the joint itself. We're going to be looking at the amount of arthritis that's present in the joint and how much of that space is lost between the two bones. From there, the surgeon or the provider will come up with a great plan on how to treat your knee. Typically, this begins with a series of injections. The first injection that we typically give for knee arthritis would be a corticosteroid. This is an injection that's given once, and then we hope it lasts. If it doesn't, we can repeat these every 3 months. Should the steroid injection not provide any sort of relief, we typically would then try the viscosupplementation injection, which is similar to injecting like 10W40 oil right into the joint. The goal with that injection is to lubricate the joint. It doesn't provide any sort of anti-inflammatory properties like the steroid injection does. Our goal with that injection is to simply lubricate the joint. Should those injections fail, then we typically have the conversation about joint replacement. Typically with a knee replacement, we try to exhaust all non-operative measures before we go forward with that surgery. Now moving on to the hip symptoms. Typically when patients come into the clinic or just in the general public, people think that their hip bone is actually located on the outside of their leg, when in reality the joint of the hip is through the crease of your groin. So typically the symptom that patients present with when it comes to hip arthritis is pain localized in the groin, greater trochanter, which is on the outside of your leg, or through the upper thigh. You might notice pain that limits your ability to walk, you have a hard time flexing, putting on shoes is very difficult, bringing that foot up to cross over your leg can be really, really hard. We then, always with a hip, look at other causes. Sometimes if you have a pinched nerve or something wrong in your back, in your spine, that can cause pain through the hip, as it could also cause pain down the knee. One of the things we look at is making sure that we differentiate exactly where your pain is coming from before we jump into some sort of joint replacement. And with that, injections really do help us. We do injections through the hip, in the knee, and also in our low back to tell us exactly where this pain is coming from so we can better treat the pain that's present. We should also look at other non-surgical treatments, which includes weight loss. Interesting statistic here is when it comes to the bones of the body, the knee joint takes on around 9 times your body weight in energy with every step you take. So if you think about that, if you're walking down the road and you're 200 pounds, that's 1,800 pounds roughly of energy put through your knee joint with every step. That's why weight loss can help with knee pain, because it offloads some of that pressure. The hip itself takes on around 7 times the body weight. So same calculation, just less of a multiplication factor there. But either way, weight loss can certainly help offload some of that pressure on the joint itself. Should we go down the road to joint replacement, we have a fellowship-trained hip and knee specialist, Dr. Eric Severson, who did his fellowship training at the Mayo Clinic. Fellowship training is where a surgeon, orthopedic surgeon, completes their orthopedic-specific training and then goes on to further education and further training in the form of fellowship. This is typically around 1 to 2 years after their orthopedic training is complete. Dr. Severson, as mentioned, did complete his fellowship at the Mayo Clinic. He does both first-time knee and hip replacements. He also is what I call the A1 mechanic when it comes to fixing hip and knee replacements that have gone bad. Some of these wear out over time, and he is the revision specialist for the Brainerd Lakes area and greater Minnesota. Here at CRMC, we do have the Rapid Recovery Protocol. Typically, if you do have surgery, we keep patients overnight. Right now, outpatient surgery and joint replacement is very common. However, it's still our standard where we do keep you overnight. About 1% of patients are able to go home the same day. If that's something you want to do, that's something that can be discussed, but right now 99% spend simply one night in the hospital. If you have any questions or request any further information, please get a hold of Cuyuna Regional Medical Center by calling 218-546-7000, ask for orthopedics. And again, my name is Adam English, and I'm the nurse practitioner with the orthopedic group here at CRMC. Thank you.